Ulcers are one of the most overlooked and misunderstood conditions in digestive health. Many people dismiss the initial signs as ordinary stomach discomfort or heartburn. But what starts as a mild burning sensation in the upper abdomen can quickly evolve into something far more dangerous. Ulcers are not simply irritations, they are actual wounds in the lining of the stomach, small intestine, or esophagus. And when left untreated, they can lead to internal bleeding, infection, and in the most severe cases, life-threatening perforation. The pain of an ulcer is often the body's last attempt to alert you before irreversible damage begins. In this video, we'll examine the causes of ulcers, the early and advanced signs and symptoms you must never ignore, how ulcers are diagnosed, and the current treatments available. The goal is simple: help you understand how serious this condition is before it silently progresses. Because ulcers don't always announce themselves loudly, many remain hidden until they rupture or bleed. By then, the risk to your health may be far greater than you imagined. Now, without any further ado, let's get started. Causes of ulcers. Ulcers develop when the protective lining of the stomach or small intestine is eroded, allowing acid to damage the underlying tissue. The stomach naturally produces hydrochloric acid to help digest food. It also produces mucus to protect its own lining. When this balance is disrupted, either due to increased acid or decreased mucus, ulcers begin to form. One of the most common causes of this imbalance is a bacterium called Helicobacter pylori, H. pylori. This bacteria infects the stomach lining and triggers chronic inflammation, which weakens the mucosal barrier over time. What's alarming is that H. pylori infection often shows no symptoms for years. By the time pain occurs, the ulcer may already be well established. Another major contributor to ulcer formation is the overuse of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, aspirin, and naproxen. These medications reduce the body's production of prostaglandins, compounds that help protect the stomach lining. People who use NSAIDs frequently, especially on an empty stomach, are at significantly higher risk of developing gastric ulcers. Stress, once thought to be a primary cause, doesn't create ulcers directly but can aggravate them by altering digestion and acid production. Lifestyle factors like smoking, alcohol consumption, and poor diet can worsen ulcer risk by impairing the stomach's ability to heal itself. Smoking reduces blood flow to the stomach lining, while alcohol increases acid production and damages the mucosal layer. These factors, combined with bacterial infection or medication use, form a dangerous cocktail that often leads to ulceration. Signs and symptoms of ulcers. Ulcers don't always cause immediate pain. In fact, many go undetected for months or even years. When symptoms do appear, they often mimic other conditions, which leads people to self-medicate or ignore the problem entirely. The most common symptom is a burning or gnawing pain in the upper abdomen, often felt between meals or at night. This pain may be relieved temporarily by eating or taking antacids, but it always returns, sometimes stronger. If the ulcer is in the duodenum, the first part of the small intestine, the pain may occur a few hours after eating and improve with food. If it's in the stomach itself, eating might actually make the pain worse. Other warning signs include bloating, frequent burping, poor appetite, and unexplained weight loss. In more severe cases, ulcers can cause nausea, vomiting, or a feeling of fullness after eating only a small amount. When ulcers begin to bleed, symptoms become much more dangerous. Vomiting that looks like coffee grounds or the presence of black, tarry stools indicates that internal bleeding is occurring, an emergency that requires immediate medical attention. Chronic bleeding from an ulcer can also lead to iron deficiency anemia, which presents with fatigue, dizziness, and pale skin. The most frightening symptom of all is sudden, sharp abdominal pain that spreads across the belly. This could signal a perforated ulcer, an ulcer that has created a hole in the stomach or intestinal wall. In this case, stomach contents leak into the abdominal cavity, causing severe infection known as peritonitis. This condition can be fatal if not treated immediately with surgery and antibiotics. The problem is, many people ignore the early symptoms of ulcers until they reach this advanced stage, when time becomes a critical factor. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of ulcers. Diagnosing an ulcer requires more than just describing symptoms. Because the signs overlap with many other gastrointestinal disorders, Doctors need to use specific tools to confirm the presence and location of an ulcer. The most accurate diagnostic procedure is an upper endoscopy, also known as an esophagogastroduodenoscopy (EGD). In this procedure, a flexible tube with a camera is inserted through the mouth and into the stomach and small intestine. This allows doctors to directly visualize any ulcers and take biopsies if necessary, especially to test for H. pylori or to rule out stomach cancer. Less invasive tests include the urea breath test, stool antigen test, or blood antibody test, all of which are used to detect H. pylori infection. While these can confirm the presence of the bacteria, they do not show the physical condition of the stomach lining itself. Imaging studies such as X-rays with barium contrast can sometimes reveal large ulcers, but they are far less sensitive than an endoscopy. Because ulcers can bleed or become cancerous, accurate diagnosis is essential, not only to treat the pain but to prevent serious, possibly fatal complications. Another often overlooked aspect of diagnosis is medication history. Patients who regularly take NSAIDs or corticosteroids must inform their doctor, as these drugs significantly increase the risk of ulcers and can complicate both diagnosis and treatment. Unfortunately, many people use over-the-counter pain relievers for years without knowing the damage they're causing inside their body. By the time they seek help, the damage is often extensive and much harder to reverse. Treatment of ulcers. Treating an ulcer is not just about relieving the pain, it's about stopping the progression of tissue damage, eliminating the underlying cause, and preventing life-threatening complications. The first step is usually medication. If H. pylori is detected, doctors prescribe a combination of antibiotics to eradicate the bacteria, along with a proton pump inhibitor, PPI, to reduce acid production and allow the ulcer to heal. Proton pump inhibitors, such as omeprazole or lansoprazole, are among the most effective medications for reducing stomach acid and are typically taken for several weeks. For ulcers not caused by H. pylori, acid-suppressing medications are still essential. These may include H2 receptor antagonists like ranitidine, though proton pump inhibitors are usually preferred due to their stronger effect. Antacids may provide temporary symptom relief, but they do not heal the ulcer or address the root cause. Sucralfate, a medication that coats the ulcer and protects it from acid, may also be used in some cases. If the ulcer is caused by NSAID use, stopping the medication is critical. However, this must be done under medical supervision, especially if the NSAIDs are being used to manage chronic pain or inflammation. In some cases, an alternative medication or additional protective drugs may be prescribed. Surgery is rarely required today thanks to modern medications, but in cases of bleeding, perforation, or obstruction, surgical intervention becomes necessary. A bleeding ulcer may be cauterized during an endoscopy, but if the bleeding cannot be controlled or if the ulcer has created a hole in the stomach wall, emergency surgery may be the only option. These are not rare complications. They are the result of delayed diagnosis and treatment, something that happens far too often due to misinformation or neglect. Ulcers are not minor irritations. They are open wounds that expose the body to internal bleeding, infection, and long-term organ damage. While they can often be treated effectively, the real danger lies in the delay. Every year, thousands of people suffer preventable complications because they ignored their symptoms or self-medicated with drugs that only mask the pain. The signs of an ulcer are clear if you know what to look for. Burning stomach pain, nausea, unexplained weight loss, and dark stool are not symptoms to take lightly. Once an ulcer forms, it doesn't just go away. It deepens, spreads, and weakens the stomach or intestinal wall. If you wait until the pain becomes unbearable or bleeding begins, you may already be facing a medical emergency. Early diagnosis and treatment are not optional, they're life-saving. Understanding how ulcers form, how they present, and how they can be treated is essential knowledge for anyone, especially those with risk factors like chronic NSAID use, smoking, or previous H. pylori exposure. Don't assume it's just heartburn. Don't wait for it to pass. The damage may already be happening, and the longer you wait, the more dangerous it becomes. Ulcers kill quietly, but you can stop them if you act early. Share with us your experiences and opinions in the comments below. Thanks for watching.